Good afternoon, and welcome everyone to this month's American Institute of Dental Public Health webinar in our Project ECHO series, Innovations in Rural Oral Health, Indigenous Veterans Oral Health. My name is Stacy Chazen, and I'm Director of the Leadership and Education Programs here at AIDPH, and it's my pleasure to welcome you all. Next slide, please. We want to start off by thanking our partners in this program, CareQuest Institute for Oral Health, the Oral Health Progress and Equity Network, UNLV, and the National Rural Health Association. We're grateful for your sponsorship and support. So our agenda for today, we're going to go over some brief housekeeping items, give you an overview of the ECHO model. We're then going to hear from our presenters on the topic of Maine's Wabanaki Veterans Outreach. We'll have some time for Q&A, and then as we always do, we'll spend time in a think tank discussion, answering some questions related to a case that one of our presenters is going to share, focused on recruiting oral health professionals to rural communities. Some brief housekeeping items. Today's session is being recorded. We ask everyone to stay on mute until it's time for the Q&A and then the case study discussion. Please feel free to pop your questions in the chat box in the meantime. Slides and any other materials, including the recording from today's call, will be available on the AIDPH website after today. We ask that everyone please type their email address and organization name in the chat. We ask you to avoid any personal health information, sharing that on this call. And if you have any questions about Zoom during the call, please chat with my colleague, Elizabeth Flannery, through the chat function. Next slide. For those of you not familiar or who might need a reminder, AIDPH has a vision of an equity-oriented oral health workforce prepared to lead. We foster professional excellence and advance innovation in the education and practice of dental public health. Our communities of focus in this work are rural communities, veterans, LGBTQIA+ communities, and individuals living with disabilities. The ECHO model, as we've shared here, and I love this moving knowledge, not people. So you join us from where you're located, and we come together on a monthly basis, learning from subject matter experts as well as one another to take learnings back to communities and apply them for the benefit of your residents. Next slide. As a reminder, this 2023 ECHO Innovations in Rural Oral Health offers the opportunity for folks to earn CEUs for each session that they attend. You become eligible for that by attending the session live and then subsequently completing an evaluation and CEU request form. We also offer the opportunity to earn a certificate in innovations in rural oral health for successfully completing competency assessments for 6 of the 7 sessions. And you have the opportunity when earning the certificate to watch the recordings of the sessions posted on the AIDPH website. So you don't need to be here live and you can still qualify for that certificate. Next slide. And here are all the topics we've covered this year, taking us to the end, innovations in rural Indigenous veterans. Next slide. Our norms, as I referred to earlier, everyone is here to learn, also to teach. We use first names only to facilitate equality in our discussion. We ask that you add your personal pronouns to your Zoom name. Before you speak, please share your name, organization, and location. Limit any environmental distractions around you, respect one another, and respect personal health information. Next slide. Our learning objectives for today are on the screen: to identify the unique oral health needs and challenges facing Maine's 5 Native American tribes, explain the key elements of Native American cultural competency and why they're critical to ensuring equitable oral health care access and outcomes in tribes, and describe the services that the Maine Bureau of Veteran Services and its partners are bringing to Maine's Native American communities to advance their oral health. So with that, I'm going to introduce our speakers today, who we're very excited to have. Darren Ripley is the Veteran Service Coordinator with Wabanaki Public Health and Wellness. He is a U.S. Army combat veteran, holds a Master's of Science in Criminal Justice Administration, and has spent his career working in social services. In his current role, he often partners with Sarah Sherman, our other presenter today, who serves as the Director of Strategic Partnership for the Maine Bureau of Veteran Services and as the Department of Defense Veterans and Emergency Management's Tribal Liaison. In 2020, Sarah conducted a 6-month needs assessment, Oral Health Access for Maine's Veterans, which led to the formation of the Maine Veterans Dental Network in 2021, as well as the creation of the Continuing Medical Education module in partnership with the Lunder-Dineen Health Education Alliance of Maine, addressing veterans' oral health needs. All of this work will inform Darren and Sarah's presentations today. So with that, I'm going to turn it over to our presenters.
Thank you, Stacy. Could we have the next slide, please? And I'm going to let Darren lead.
So a little bit of our history with Indigenous people here in Maine. We have 5 Native American communities. They are located right there on the map. We have 2 Passamaquoddy communities in the Sabayeg and Madocmigook territory, which is in Washington County. Then there's the Maliseet and Micmac and Aroostook, and here locally in the Bangor area, located in Old Town on Indian Island, is the Penobscot Nation. We have called Maine home for more than 12,000 years, and we are called the people of the dawn. Next slide, please. So in Maine, our 5 tribes, we have served in every military conflict since the Revolutionary War. Currently, there are approximately about 500 Indigenous veterans living in Maine who have served everywhere from World War II to the current global war on terrorism. 2009, Maine had passed a law recognizing that June 21st is the Native American Veterans Day, and every year the tribes celebrate Native American Veterans Day. We celebrate that more so than the normal Veterans Day, just because this is kind of, specifically highlighting our Indigenous population service to our country. Next slide, please. So the Veteran Services Program here at Wabanaki Public Health, this has been going for, well, I've been here for almost 2 years, and since coming on board, I've been welcomed with open arms by Sarah Sherman's Maine Bureau of Veteran Services and other veteran organizations. We work with the Maine Bureau of Vet Services and the Maine VA to really try to improve access to benefits and veterans resources to our tribal communities. Our tribal communities are located further away from a lot of healthcare resources, a lot of healthcare facilities. They do have to travel sometimes 2 hours or more to get to some appointments, especially if it's a specialized referral. So we're really trying to help bring a lot of benefits and resources to these communities ourselves, so they don't have to travel so far to file claims, to get information about assisted living or enroll in healthcare. They can all do that on their own home. So far, we have held 2 different claims clinics in the Passamaquoddy territories. We have helped some veterans after I believe 50 years and 3 previous denials with a service-connected disability. We actually finally helped him get a service-connected rating for his injuries received while in Vietnam, and we did that because we brought the veteran services officers to the tribal communities and they were able to help that veteran there in his own backyard. I also act as an advocate for our veterans going through the disability and claims process if that is needed. However, I don't do it for all veterans. Some veterans are able to do it themselves and advocate for themselves. Other veterans, either because of advanced age or because of a physical or mental health status, that they're not able to advocate for themselves. So I kind of step in if that is needed. Next slide, please. So our Veterans History Project, I got this idea from the Smithsonian website because they have this Veteran History Project that's going on where the veteran can kind of record themselves, and there's a standard set of questions that they kind of speak on. They record themselves and send it to the Smithsonian to be archived and filed. And I wanted to do that with our tribes up here because I know that we do have veterans who are combat veterans, or well, even the non-combat veterans. They have experiences that should be told, and I believe it's a very important part of our history because, you know, we've seen movies like We Were Soldiers, Band of Brothers, and so we see this individual experience of combat, and I wanted to showcase the Native American, the Indigenous person's perspective of their military service. You know, what was it like being Native American in the military? Did you deal with racism? What was it like being Native American, you know, growing up in the 40s or the 50s or the 60s? Because obviously growing up in the 2000s on a reservation is vastly different than growing up on a reservation in the 50s or 60s. And it's just, you know, I wanted our future generations to really to really see what our veterans had went through growing up on the reservation, had went through in the military, and just kind of show them that, you know, that these people who have, you know, who hold a very important place in our nation's history, they are right there in their community, and it kind of gives them something to look, someone to look up to hopefully aspire to be like, or to just use as an example of, hey, I don't have to, you know, I don't have to play a victim because these people have done A, B, and C, and they've done great things, and they continue to do great things for their community, for their people. There is hope for me. Next slide. So Nibezun is another nonprofit organization that we work with here in the Bangor area. They are located in Penobscot County as well. So far, we have worked with Nibezun in partnership with Maine Bureau of Veteran Services and the Maine VA to do a Wabanaki cookbook as a present for, well, as a gift for our Native American veterans. This past Native American Veterans Day, we held a ceremony at Indian Island where we had veterans agencies present, and there was drumming, there was traditional ceremony and prayer that had gone on before the ceremony had started. And as part of the presentation, our food sovereignty department here at Wabanaki Public Health had prepared a traditional meal for the veterans, their families, and the organizations to try, which is a recipe that was in the Wabanaki cookbook. So the veterans that were present there, they did receive a copy, and I have been tasked with handing out the cookbook to other veterans as I attend events and see them and within the communities. So that's still a process that that I am working on. Next slide.
So I'll jump in, Darren, if you want. So one of our other partner agencies is the Maine Veterans Benefits Administration. And starting in September of 2022, they were hosting a large expo for veterans and their families. And one of the first connections they made was with Darren, and invited him to have a table at this event. Then in October, the VA and my office came up to Indian Island. And as Darren mentioned, we did our first outreach event. In November, the VA was introduced to the tribal council member to Nibezun. And in February, we did 2 additional outreach events in the Passamaquoddy communities, and then another expo. Next slide, please. In June, as Darren mentioned, we had Native Americans Veterans Day on Indian Island. And in July, again, another expo. We were working on bringing tribal veterans representative training to Maine. That's an ongoing discussion. And in September, again, another event in Calais, which is in down East Maine. Next slide, please. So I work for the Bureau of Veterans Services. We are Maine's advocates for veterans and their families. We're the state side of veterans advocacy versus the VA being federal. We have 7 field offices across the state, staffed by veteran service officers who help veterans make their claims. Service Connection, we oversee the 4 veteran cemeteries, run an emergency financial assistance fund, work with homeless veterans, and I oversee the Maine Veterans Dental Network. Next slide, please. So I've been working with the Bureau for 5 years, and one of the most momentous occasions is I was invited to attend a powwow, a Veterans Memorial International powwow on the grounds of Togus, which is Maine's VA hospital. I have never attended a more welcoming event, and afterwards came back to my boss and said, you know, what are we doing to work with Maine's Native American veterans? And his answer was, well, why don't you go find out? So I wrote to the 5 chiefs, and over a period of time received invitations to visit the different communities. Next slide, please. As Darren mentioned, he works for Wabanaki Public Health and Wellness. These next few slides are going to be my observations in talking with people in the communities. I am in no way representing Darren's agency, and I just wanted to clarify that. So when I was working on the report back in 2020, I learned that the Passamaquoddy Tribe has 2 reservations with small dental clinics, and dental care starts early with a dentist linked to their preschool programs. And that the Penobscot Nation, which is down near Bangor, has a full service dental clinic on Indian Island. Next slide, please. For the Maliseet community, which is up near Houlton, they have a fully equipped dental suite, but are not able to provide dental care for lack of staff. And this has been an ongoing issue. However, they do pay for dental services through purchased and referred care, which is much like the VA's community program, where if they can't provide the service, it's provided in the community, and that is through a contract with Indian Health Service. Next slide, please. The Aroostook Band of Micmacs have their own dental clinic. They had at the time of the report, had a part-time program going, and had reached out to the Maliseet community and was taking some of their community members there for dental care. But it's a 1-hour drive. Next slide, please. So the report's been out for 3 years. The Maine Veterans Dental Network has been up and running for 3 years. In this amount of time, the Passamaquoddy community has lost their dentist, and some veterans, as Darren mentioned, are driving over 2 hours to the dental clinic in the Penobscot Nation to seek treatment. Any Wabanaki veteran can apply to the Maine Veterans Dental Network, which provides connection to a dental clinic and a $500 grant per year. And as I just mentioned, there's roughly a 1-hour drive between both the Maliseet and Micmac communities in very northern Maine and the 2 Passamaquoddy communities. It is my opinion that both areas could greatly benefit by sharing dentists and hygienists. And as we'll talk later, the issue is how do you get them to rural Maine? Next slide, please. So criteria for the Maine Veterans Dental Network, very low bar. You have to be a Maine resident, not 100% service connected to the VA, meaning that a veteran is eligible to get their dental care through the VA. In Maine, Togus, Portland, and Bangor are the only VA facilities that offer dental care. The veteran must not be able to afford to pay for dental care out of pocket and does not have dental insurance, and they must show that they have an honorable discharge. For our National Guard members, they have to show they served on active duty. Next slide, please. Currently, we have 22 dental clinics participating. They consist of federally qualified healthcare centers, nonprofit dental clinics, and Maine's 2 teaching schools. In 2023, we also gained a mobile dental clinic, and we ran a pilot project in Down East Maine, bringing care to veterans at the Maine Veterans Home in Machias and veterans from surrounding communities. This is a grant-funded program. Our sponsors are Northeast Delta Dental, and in this year, the Maine Masonic Charitable Foundation. The grant funding will cover preventative, diagnostic, restorative, oral surgery, and major restorative. We do not cover implants, orthodontics, fixed bridges, telehealth, or PPE charges. This program is run first come, first serve until the funds run out. And the veterans usually say, Sarah, you know, that's fair. And veterans are told, you have this much coverage with the grant, you'll receive a dental plan. Say the plan is going to cost $750. They are financially responsible for that extra $250. And again, the response I typically get is that's fair. Next slide, please. When working with veteran patients, I really try hard to promote with all our dental clinics trauma-informed care. Many of our veterans have PTSD symptoms. Sometimes we call them silent symptoms, and just simple things like when a veteran is new to the dental office, give them a little tour so they can be aware of their surroundings. Explain what's going to happen and what to expect next. Let the veteran make decisions. You know, don't touch me on the shoulder, or could I listen to music while I'm having the procedure done? And just basic, which I think this is sort of oral hygiene 101, but just check in on the veteran. How are you doing? Do you need to take a break? Next slide, please. So also, you know, we try to train our clinics. Ask the veteran, do they have any conditions that might impact their dental care? How are they doing? Do they need any extra assistance? We have one veteran who likes the last appointment of the day because there's less people in the office. And these are the little, because we're a small program, we bend over backwards to make sure our veterans receive that extra level of care. You know, a veteran with PTSD doesn't want to be treated like a wounded bird. Just validate their resilience. Next slide, please. Darren, I'll pass it back to you.
Certainly. So far, this is some of the stuff that we have done with our veterans because my program here is grant funded by the CDC's suicide prevention grant. A lot of what I have been trying to focus on is evidence-based practices, cultural and non-cultural. Um, so part of our cultural based activities is harvesting birch bark and making birch bark moose calls. So in the fall, when moose season starts and mating season kicks into high gear, we use the birch bark moose calls to imitate the sounds of a female cow, and through that birch bark cone, that call, that'll carry that sound through the woods and hopefully bring in a bull, and so we can harvest that for our families and our community. There's also sweat ceremony that we have done in Sabayeg as well. We've done drum making in the Penobscot territory, the Passamaquoddy territory, and just recently, the day after we got back from Washington, D.C., I drove the 2 hours to Houlton for a Veterans Day ceremony, and we started the veterans drum making with the veterans and their family members after the ceremony and brunch had ended. So we've done a few so far. We've also have partnered with Doc Goodwin's organization, the Maine Veterans Project, for a joint veteran adventure by canoeing down the Penobscot River, staying overnight on the Penobscot Nation's Sugar Island, and kind of teach the other non-native veterans a little bit more about the Wabanaki history in Maine. I know now there's a law where Maine schools are required to teach Wabanaki history to the students, but it's still not a very in-depth topic that is taught in the schools. So by sharing our history and our culture with these other veterans, that kind of, help to educate them more about everything regarding our people and how and why we do some ceremonies. Next slide, please. So these are just two examples of the flyers that we had done up for our claims clinics last year. As a matter of fact, we have meeting tomorrow with the Veterans Health Administration and the Veterans Benefits Administration, and I believe also with Maine Veterans Bureau. We are hopefully going to do the claims clinics for the Sabayeg and the Indian Township communities again this January. We got a really good reception last time by the tribal chiefs, and they would like to have us back. So we're trying to plan another claims and benefits clinic for our veterans and hopefully trying to reach more veterans. I know with those two territories combined, there's probably 90 veterans that are currently living, and we hope to at least bring in a quarter of those veterans to our claims clinic so they can learn about things like VA home loans, living wills, other healthcare benefits that they may not think about. And next slide. So this was another flyer, an advertisement that was done up. I believe this came from Jennifer Bover's office. She works for the Maine VA. This was to advertise our Native American Veterans Day ceremony that we held, and this is just a cover of the Wabanaki cookbook that we have. Next question. Slide. And these are just some pictures of the ceremony. It was very rainy that day, so it was kind of windy and chilly, but we still had a pretty good turnout with the veterans and the other organizations as well. There was the drumming, like we had said. Next slide. And Sarah?
So in June, I was invited to attend Tribal Veterans Representative Training and was lucky enough to attend the Saginaw Powwow. This training is specialized for anyone that works with Native American veterans. And I'm hoping that we get to bring this program to Maine. And there's David, Gregorio, and Rodney, who I always sit in the front of the room. And by the time we hit Friday, they were calling me little sister. So they took me to the powwow, and these are some pictures Gregorio took there. It was just, again, an amazing cultural experience. Next slide, please. So last year, my big boss, Major General Douglas Farnham, designated me to serve as the department's tribal liaison. And in that capacity, every 2 years, I am tasked with creating a report that goes out throughout the state. Next slide, please. And as Darren mentioned, not only have we been working within the state of Maine, but we traveled to the Pentagon just a few weeks ago. And it was an amazing experience. Native American Heritage Month, we met members of 30 tribes from across the United States. And there's Darren featured in an article in the Portland Press Herald about the work we've been doing. Next slide, please. So to sum up our presentation, we live in a very rural state, and what we have found most effective way to serve Native American veterans and their families is to work collaboratively with other agencies and to bring services directly into the communities. We all have strived very hard to create partnerships steeped with respect, trust, and cultural awareness, and hope to, we're looking towards 2024 and expanding our Maine Veterans Dental Network, and hoping to continue this work within the Wabanaki communities. Thank you.
Thank you, Sarah and Darren. And Rahel, if you could stop the screen share just for a little bit while we have some discussion. And I want to open it up to any questions. Also want to point you all to a link that Liz just posted in the chat. And that's going to give you some more information about the Maine Veteran Dental Network online request form, if you want to check that out. So I'd like to start off with a question while other folks are thinking and want to pop their questions in the chat or raise their hands. But I wonder if one or both of you could speak to what's enabled your partnership to be successful between your two agencies? What would you attribute that to?
Go ahead, Darren.
Well, I think one, myself being a veteran and really, having those typical veteran struggles with accessing benefits or getting, benefits and access to healthcare services. So I'm familiar with that, and I really try to, make it easier for other veterans to really, to get what they've earned. But also the fact that where I'm Passamaquoddy and I'm from the Indian Township community, I know what it's like to grow up on a reservation. I know what it's like to be Native American out out off the reservation, and I'm more familiar with a lot of the struggles that Native American veterans face. And when and normally, any Native American community, they're usually going to be standoffish to any outside organizations, whether it be state help, just because traditionally, historically, there really hasn't been any good that has come of a lot of outside help. But I think where there's a familiar face in the community that's bringing in these other agencies and working with them and making friends with them, I think that helps our partnership and really is, we are very welcome and back to the communities.
Thank you.
And I just spin off of that, I just have this natural curiosity, and love to ask questions. So, as I started to work my way and visit and introduce myself to the other communities, I started to learn for many Wabanaki people, their first language is not English. So I have been going to the Wabanaki online dictionary and trying to learn words as we go. Darren, help me if I'm wrong, but I'm going to greet everyone. Gwe Dungok. How'd I do?
Good.
Good. So I just said, hello, how are you? But keep in mind, there's 5 separate languages that come with each of these communities. Their traditional foods, their traditional crafts. I'm interested in all of it, and I think my enthusiasm has shown. The other thing, knowing the history of other agencies coming into the communities, if I tell them I'm going to do it, I do it, and I do it on time. And the biggest request we've had is bring the services to us. Nobody ever comes to us. So, working with a partner like Darren, who knows the communities backwards and forwards, I really attribute him and his innate knowledge of the communities to our success.
Great, thank you. Maybe we'll have one more question and then we'll move to our case discussion.
I have a question, Stacy, but I don't want to take the floor if there's a participant who wants to chime in. So put it in the chat if I'm taking someone's spot, but to kind of piggyback off of Stacy's question, kind of the flip side of that, thank you for your presentation and the work that you're doing. Your partnership just seems so wonderful and successful. And the point of these calls is so folks can hear these stories and take this information and hopefully replicate similar pieces in their own communities, their own states. And so to the partnership piece, there's also kind of that state administration piece, red tape potentially. Sarah, you mentioned at the top of your presentation that your boss said, why don't you go find out, which is such a great response and so wonderful to have that directive. What would be your response to people or advice to people if they're trying to get started on that kind of more admin side of it to kind of make change or the desire for change to happen?
Again, I think it's integral to show up in person, make an appointment, keep it, be forthright in what your intentions are. And I found one of the best questions I had in my toolbox is, what could I do to help? And then be a good listener.
Thanks for that question, Liz, and thanks for that insight, Sarah. So, Rahel, if you could share the slides again, and I'm going to ask Sarah to present the case. Sarah, if you're good with that.
Sure. So when I started this needs assessment back in 2020, I call it the science fair 3-panel board that you buy at Staples. And every question, every problem I was trying to solve was represented on this board, and it was completely full by sticky notes. And the report came out, and as we started to form the program, the last sticky note on the board was finding oral health professionals to staff the dental clinics within the Wabanaki communities. This is I love solving problems. This is the one problem I have not been able to find a reasonable solution to bring to the Wabanaki communities and say, would this be helpful? And I'm out and about talking to enough oral health professionals that I thought by now we'd have this solved and something to present, and we don't. As we mentioned earlier, the Maliseet and Micmac communities and the two Passamaquoddy communities, both very rural and roughly have a 1-hour travel time between them. So potentially they could share staff between the 4 clinics. And just wondering if we might put our heads together and come up with some possible solutions. Thank you.
Can you take us to the next slide, Rahel? So the questions that are being posed to you then are, what strategies could be used to recruit the necessary oral health professionals to the clinics in the short term? And then what strategies or programs could be implemented to develop the oral health workforce in the long term? So now I'll ask you, Rahel, to stop sharing so we can all see each other. And thank you. And would love to start with the first question. So this is meeting the short-term need, or meeting the need in the short term, getting the resources, the providers in place to be able to meet the oral health care needs. What are some suggestions, examples of things you've seen work in other rural communities or in other communities overall that you might suggest? And we encourage folks to put their camera on if they're able.
Stacey, I did have a clarifying question. Is that all right?
Yeah.
Just more like a landscape style question.
And Caroline, could you just introduce yourself to folks?
Sorry, yes. Hi,
Okay.
I'm Caroline McLeod, and I'm with CareQuest Institute and one of the faculty working with AIDPH on the ECHO. Thanks, Stacey. And so my question is, before we jump into suggestions, just because I'm unfamiliar with Maine, so I live in the South in North Carolina, so I apologize. Is there a dental school or multiple dental schools in the state? I know you said it was rural. Do you have any of those, or dental hygiene programs? What's your training like in the state?
We have the University of New England has a dental school in Portland, which is southern Maine. And the University of Maine, Augusta has a hygiene school in Bangor, which is close to the Penobscot Nation.
Great. Thank you so much for that. I appreciate understanding the environment a little bit more.
Okay, think tank, what are your thoughts?
My name is Maliseet. I'm a PhD student at Oregon State University. I'm also a dental hygienist, and I'm gonna go off of what Caroline was thinking about. I think was utilizing dental hygiene students and dental students as trainees and providing health dental health services. I think from a personal experience, just the exposure to community-based dental programs in the dental hygiene school was the leading point for me to work in a community-based program and a mobile dental unit. And I feel like within my research that all the dental hygienists that are participating in my studies who are working in community-based programs, they don't want to leave and go to private dental offices. So once you get people exposed to this type of program, you might find more acceptance and what's the word I'm looking for? Motivation to join. Yeah, hope that helps.
Sarah or Darren, are there any loan repayment plan programs in the state of Maine that could incentivize providers to serve the communities?
Yes, there are. And especially if you're serving in a rural area.
And so is there much uptake of that?
Well, one issue with that loan repayment programs is if you are qualify for one and then another dentist happens to move in nearby, that person suddenly doesn't qualify for the loan repayment because now it's not an area with a dentist shortage.
Wow.
So there has been hesitation to participate for fear of not being able to repay loans.
Wow. So if you're in the middle of the program and someone moves there, it ends?
You may not be able to renew because now there is another dentist, say within a so many mile radius.
Wow.
Yeah.
Unfortunate.
Yes.
And what about, what is the representation in the dental schools, in the dental school and the dental hygiene school of the tribal communities? Is there much enrollment of members of those communities in the schools?
I do not have an answer for that question. Darren, do you have any idea if anyone is currently?
I don't have an answer for that, but I do know that in Maine and in like a lot of other states, so with the Native American educational waiver, that allows any enrolled tribal member in the state to attend any University of Maine school, or community college or Maine Maritime Academy, for free. So the tuition's waived, for all 4 years. So that's to encourage our tribal members to attend post-secondary careers. So I do know that that's in place, and that will cover something like the dental hygiene program at University of Maine, and I believe that I think the University of New England might fall into that same type of school. I'm not quite sure, but that program is in effect to encourage that post-secondary career.
Right. Yeah. So I'm thinking, I wonder if some type of program some outreach in the communities that encourages students to go down that path and makes them aware specifically of the oral health programs in the state, highlighting that there would be no cost for them. And there I'm thinking obviously about the long term fueling that pipeline.
Yeah, and with our tribal communities, there's still a lot of cycles that need to be broken, whether it's through the family or external factors. There's a lot of cycles that need to be broke. Like we kind of need to encourage the younger generations that getting an education is very important. Being healthy, taking care of yourself is very important, because nowadays, and not just on a reservation, but in today's society, teenagers are really experimenting with very risky behavior, very illicit drugs. There's no more smoking weed behind mom and dad's back. They're bringing in stuff like heroin and fentanyl into schools, and it's very widely used. If we can break that type of cycle in our community, we can hopefully encourage more education and to go out and be able to get a career, and they can come back to their reservation and their communities to help their people with what they have learned.
Right, exactly. And Robert put in the chat, encouraging homegrown talent to stay in the community or come back to the community. I lost his, is so much better than a hired gun, right? That they're from the community. There's a good chance they're more likely to go back and serve members of their community. But I hear you, it's not just about going in and saying, hey, you ever thought about being a dentist or hygienist, right? It's a lot more complex than that. So I appreciate that. Christina asked, is there legislation for mid-level providers or dental therapists in Maine?
This is currently being worked on, but there has been quite a bit of resistance.
Yeah.
Yeah, so fingers crossed. I think it would be a great solution, but it's a work in progress, I guess is how I would leave it.
And Robert suggested pairing up young students with practices from middle school on up to start the process, right? That mentoring, ideally with oral healthcare providers who are Native Americans, to see that modeling.
Yeah, even work study programs at a high school level.
Yeah.
Yeah.
Other thoughts?
Sarah and Darren, I'm curious, we were talking about the rurality of the landscape in Maine and these communities in terms of access to dental care. Would you say it's the same for medical care? I'm just trying to think, at least potentially for a starting point. I mean, it's not robust dental care, but having medical providers provide screenings, potentially fluoride varnish, things like that kind of gets the ball rolling in oral hygiene education with patients. So I'm just curious if you would say that access issues in medicine are the same difficulty.
Well, I can speak for the Passamaquoddy community in the Sabaig territory, because I was kind of exploring last year in the different tribal territories what mental health access that that the veterans had in the communities, what they had for healthcare, because again, especially in the Washington County area, there's only the VA primary care clinic that's in Calais, and then you have the Indian Health Services on both reservations, but not everybody is going to qualify for healthcare through Indian Health Services. So we kind of have to look at what are the other options. And in the Sabaig community, they had a pediatrician, but after their 2 or 3 year contract is up, they kind of beat feet. It's a very, very rural area where there's not a whole lot to do. There's one Walmart in the whole county. If you want to go anywhere to do anything fun, you end up having to drive 45 minutes to an hour away. It's just very isolated. So a lot of the younger healthcare providers, they don't want to stay there forever. They don't mind coming in and getting a few years experience working with a small community and then leaving. So that happens with the pediatricians, that happens with primary care doctors. And I know that there are primary care doctors in that area, but they have private practice, and they can only take so many people. So there's a big disparity with access to a lot of healthcare in the tribal communities, and not just for veterans, but for the tribal community as a whole.
Something we probably should have mentioned from the beginning, when we're talking down east in northern Maine, there is no public transportation. If you don't have a vehicle, you are not getting to an appointment, and it's probably too far to walk. So transportation is another solid issue that factors into this, as well as the remoteness of the different communities.
Thanks for that. And thanks, Amna, for adding some suggestions and a resource link in the chat as well. Any final thoughts before I ask Rahel to take us back to the closing slides? Okay. Well, thanks everyone for the thoughts, for the brainstorming and strategizing and sharing. So as I shared earlier, next steps are here. CEUs are available for today's session. The survey link is going to show up in your browser immediately after the call and will also be in the chat box. Recordings of today's call and resources, the slides are going to be available on our website. We'll also be preparing a summary of the ideas that came up during this brainstorm. and we'll share that on the website as well. Want to remind you again about the opportunity to earn a certificate in innovations in rural oral health. You can get more information about that on the AIDPH website or reach out to us, programs@aidph.org, if you have any questions. And as I told our speakers before we started, this is the last ECHO, and I mentioned to you all, this is the last ECHO session of this year. Please stay tuned for dates and topics of what we'll be offering next year in early 2024. And then last but not least, I want to call everyone's attention to a really exciting event that we have coming up at AIDPH, our 2024 colloquium on the topic of community collaboration in oral health, advancing person-centered outcomes. Early bird registration is still open, and we have opportunities to submit abstracts to do either a roundtable or a verbal presentation or a poster presentation. We just extended the deadline for that to December 11th. So you can scan the QR code on the screen, visit our website for the link to register for the colloquium and to apply to make a presentation. If you have any questions about any of these, also reach out to us, programs@aidph.org. And I want to thank Sarah and Darren again for your time, for your thoughtfulness. I learned a tremendous amount from both of you today. I'm sure others did as well. And thank you for doing this work. This was really a moving, impactful presentation, and I'm thankful that we have you in the field. So thank you, and enjoy your holiday season.
Thank you.
Thank you for having us.
Our pleasure. Bye-bye.